valued viewer. Trust you're keeping well. We sure are on this side of the bookshelf, broadcasting live from the studios of Western Spring Television, and we are super delighted to be making a return. My name is Lola Raphael, honored to be your teaching and learning advocate. All right, the theme for this season that we're in on the bookshelf is for us to prioritize, and that was a play on words where we talked about prioritize as the proper prioritize, and of course, talking about priority and the care of the eyes, the sense of sight. It's a major tool for reading. Definitely people get to read with their hands, talking about the braille, but we're talking about these eyes now, care of it, which the vast majority use in appreciating and of course reading, appreciating text, and of course text and signs and reading. Now, the last time we met, we talked about determination, and some people, like they say in this part of the world, some people went to bath soap so that I will not come and do correction. But that is why I am not just the teacher, your teaching advocate by word of mouth. Your teaching advocate by training, and your teaching advocate by experience. So when we do have sums in class, then you do have what we call corrections. In fact, up until last night, I was speaking with a teenager who was telling me, okay, so we did this, and then I made an error and all that. I said, oh, okay, so you made the error. You know, some persons are fond of, they made mistakes, say an examination, a test. Don't do la cram la pour. You know, where you just cram and then you just throw everything out, and once you're done, you don't go back to check. That's the root of a loser. Don't do that. So I said, okay, you have made that mistake and you believe you will never ever come across it again in your life. It's a big lie. In fact, it's a very dirty lie. So I said, whenever you write an exam, it never ends with the exam. You are not studying to pass an exam, as important as that is, because that is proof that you actually followed the class. You're studying to become. You are learning to become. You are not learning to pass. We need to clear that out of our heads. Don't learn to pass. That is the root of failures. Don't follow that pattern. So we are going to be doing correction. We talked about determination, right, the last time we met, and of course it was my BTS team. Some members of my BTS team, because we have quite a number of them. So I brought on a couple, 4 of them. And my mental math game was not just up. Sammy believes I will not mention his name. I'm going to mention Sammy's name. He's going to come on this set on Friday. So I'll show you the person who was supposed to be at the back end. I was supposed to be giving me the right figures. So for Bimbo, that's our makeup artist, was the first person on set, and she had 11. So that was supposed to be 11 by 11, I believe. And then I did my multiplication as 11 by 10. Okay, so 11 times 10 is going to give you 110. 11 times 11 is supposed to give us 121. So Bimbo actually went a notch ahead of Adeyemi, the sound guy, who had 120. And even for Dami, the director, who had, you know, in fact, he actually had the highest, or he was supposed to have more, but of course, as I said, and I apologize for that, the mental math game wasn't just up at that time. But then again, we're doing better, right? We're getting better by the day. So today, we're going to be looking at the health angle with regards to the theme for this season that we're in. And we have joined us from Light Eye Care and Opticals. We promised that we're going to be doing this as much as we can. Thankfully, I didn't give a particular frame, not because I'm being cowardly or because I'm not looking forward to keeping my word, but you know, sometimes some things just happen that's beyond you, and you don't just but we have promised, and thankfully he was able to make out time to be with us again, looking at the medical angle of prioritize, the theme for this season on the bookshelf. Hi, joining us from Light Eye Care and Opticals, Dr. Bless Onha. Thank you so much for joining us again.
Thank you very much for having me. I'm very grateful to be here. It's a privilege to be here once more to share knowledge with our viewers. So thank you very much for having me today.
Thank you very sincerely. Okay, so without further ado, it's going to be a presentation type. I do not want too many questions. Definitely there will be questions, but I really want to control the questions so that doctor can have a full, quite, much time on his hands to do the presentation. And today we are going to be more of the focus today is going to be on eye conditions and disorders. I decided eye conditions and disorders because some persons will be like eye conditions or disorders. But then again, let's just do eye conditions and disorders because some of these things may be playing at the same time in some persons. So let's just leave it at that, eye conditions and disorders. So Dr. Blessed.
All right, thank you everybody. Let's start this way, okay? Talk about the eyes. Last time I came here, we did a full-on expose on the eyes. Okay.
The eyes.
So talking about the eyes today,
okay,
we'll be focusing more on the disorders and the different eye conditions. Okay. Talking about eye conditions, you could be in a perfect eye health. Okay. And then you can have different conditions. Okay. So let me not waste time or maybe speak long or speak big grammar. Okay. So I would like to make it simple so that the viewers out there, you people at home, can understand it much more better. All right. So eye conditions could be something, let's say the state of your eyes. Okay. We have people that we call emmetropes. Those are people that have good eyesight. They can see you very well, both afar and at near with no issue. Okay. Then we have ammetropes. Those people who have different form of eye problem. But most time, we can classify this to refractive error. That is, those things, this term I'm using now is mainly, we can use it mainly if you're talking about conditions that glasses can fix. Okay. All right, so we have the emmetropes and the ammetropes. So breaking this down now, all right, I would like to make reference to the World Health Organization because they are the people who do the research and come up with a lot of things that we are working with in the medical field. So World Health Organization has postulated from their research that over 2.2 billion people worldwide have one form of eye issue or the other, or who are visually impaired. Let me use that word. Okay. And looking at it, you find out that most of it, are more than half, that's 1.something billion people worldwide, have issues that could have been fixed or could be fixed by using glasses. Okay. While the other ones are based on pathology, that's sickness, one form of sickness or the other. And then furthermore, speaking on this, there are about 5 major ones that they brought out. Okay. Major eye conditions that they brought out. Okay. The classes, we can put in refractive error as number 1. Those are those conditions that glasses can fix. All right. So in those ones, we can have myopia. That's people who are short-sighted. They can see something that are close to them, but find it difficult seeing something afar. Then we have those people who call hyperopes. Okay, or hypermetropia. That's if some people in primary school, that's what they tell them. So those are people who can see majorly things that are far, but have difficulty seeing it at near. But sometimes they can have both far and near disorder. Okay, but they are majorly corrected with the type of lens that we give to people who have far-sightedness. Okay. Then also we have a condition we call astigmatism. Okay. To better explain it, those people do have issues seeing both far and near. Okay. Majorly, if something is straight like this, they will have to see it this way. Okay. That's why I don't know if you have seen people that sometimes if you are looking at them, this is the way they look at you. They have to bend their face in order to see people. All right. Sometimes they don't do it voluntarily. Right, but because of the state of their eyes, that's the way it's working for them.
I get
all right.
That.
Also, we can now go down to a common one that we see among aged people, all right, or people who are entering middle age to elderly states. Also, we call it presbyopia, but it is not a refractive error. Okay, it's more based on age. There is a particular time or age one will reach. They will find it difficult seeing things that are tiny. Okay, it is not a sickness, all right, but it's majorly based on age. And these things become more prominent, or people start having symptoms at the age of 40 and above, all right? But majorly when they normally find it very difficult to manage their eyes, especially at 50 years and above. But that is not a refractive error per se, but you can fix it by glasses, okay? People who normally face this are people who have good eyesight or emmetropes, like I've said before. Those are the people who can see things that are far, but find it difficult seeing things that are tiny, so it is normal. So on their list again, number 2, we talk about cataract. I know many people would have heard of cataract, okay? Cataract is the cloud. Let me use this model, okay? As an example, okay? Last time I came, I tried to dissect these different parts of the eyes. Yes. So this is what, this is where cataract occurs, okay? And this is also where that condition, presbyopia, also occurs, all right? This plays a role too, because if you are talking about being able to see something that is very close to you, this has to make change. This changes shape. It becomes more convex, that it bends more. That will enable you, okay, to see something tiny, all right? So in the case of cataract per se, and when this becomes cloudy, you understand? When this becomes more cloudy, that's where cataract starts coming into play, all right? Eventually, everybody gets to get cataract. You understand? Everybody. Eventually, okay? That is, it could be 100, but if some form of cataract, eventually it happens. But for some people, it happens early, okay? It could be as a form of trauma, you understand? Or some people who have, let me say, issue like diabetes. Most people who have diabetes tend to have issues that has to do with cataract. Do you understand? So different conditions can cause it. Maybe because of age, trauma, some kind of issues you can have. It might be cholesterol, high cholesterol, or diabetes, you understand, can cause you to have cataract. But if you have cataract, you can find solution to it. The best way of treating cataract is by doing cataract surgery, all right? But it is a minor surgery, a safe surgery that has little form of complications when you do it. So most times these are part of things that causes eye disorders, okay, that we face. Cataract is one of them. Number 2, based on World Health Organization. Then there's something called age-related macular degeneration, all right? That has to do with age, all right? Some kind of macula. You can find it, if this model, all right? You can find it somewhere here, all right? Your macula, all right? Because of age, there can be issues with this part of the eyes, all right? Let me bring it close so people can see. Something, let's say something like this. This is the macula, all right? So
that space within the red line?
Yes, that's this yellow spot here. Okay, we can use it as a macula. It's different from your optic nerve. This part that moves information from your eyes to your brain.
To the brain.
So this is, let me say, the point that it makes you see things straight, your straight vision, okay? Yes, this helps you see very well, your central vision, this, okay? So there could be degeneration here. There are fibers inside of here, okay? Because of age, there could be some issues there, okay? That's what we call age-related macular degeneration. It can happen with age, especially those are 60 plus. That's where this mostly occurs, okay? They'll start losing central vision, okay? These are under cause, okay, of visual disorder, all right, based on World Health Organization. So number 4, we'll talk about diabetic retinopathy, okay? This is a form of complication that arises from diabetes. I believe that our viewers know what is diabetes. When you have a lot of sugar in your blood, that's said simply, put simply, all right? So it's a kind of complication that occurs when the sugar is high. And most times people don't really know. Sometimes they'll tell you they know that they have sugar, but they are not checking it. They know that it is well. Because most times people tend to check it only when they start feeling some kind of symptoms or so that they have had. All right. So this is a complication, diabetic retinopathy. It can cause some kind of bleeding, different things which you might not see. You understand? Is when we do our examinations, that's when we can see those issues that happen. It's a complication that arises from uncontrolled or unmanaged diabetes. All right. So it can cause some kind of blindness. Though you can treat it, but it takes time. So the best things in all these things that I'm mentioning is trying to avoid getting them, because it is not easy to treat. It could be expensive. That is why many people, especially in this part of the world, it is not easy to treat these issues. Some people, once they check it, they just lose hope, and that's it. All right. So the fifth one I'll be talking about is glaucoma. I think many people have heard about glaucoma. Okay. Yeah. So glaucoma, let me try to define it and maybe make it to be understandable. Put it in an understandable way. Okay. First, medically, we can talk about it as optic neuropathy. All right, which causes loss of your peripheral vision. Okay, and can be characterized by the increase in your intraocular pressure. All right. So let me break it down, okay? So glaucoma affects this nerve here that I've been talking about, the nerve that passes information from your eyes to your brain, all right? So it affects, creates a kind of hole around there. It kind of becomes a bit cupped, all right? And then around here, all these vessels, some fibers will be lost. All right, when this happens, okay? And then as this is happening, it happens over time. The reason why many people don't really know or notice this on time is because it works by somebody losing the peripheral vision. There's something we call peripheral vision, and that is sideways. Like if you're looking at me, like you're looking at this television, by your right and your left, you could see some things. But some people who have glaucoma will lose those vision. But because most times we don't pay attention to those vision that we are losing, or we are not really looking at our side, we don't focus there, we notice that we won't be seeing their front vision or their central vision will be very okay. All right, they can see things that are far or they are straight. Just ahead of them. Yes. So most times before they notice, one eye has already gone. Okay, and then sometimes they have lost vision. And one thing about glaucoma is that it is any damage that has been done is irreversible. You can only manage glaucoma. That's how dangerous it is. So it's okay. So compared to cataract, glaucoma is worse. Is worse. Okay, glaucoma is worse. They call it the silent thief of sight. Because when it's happening, nobody really knows, nobody really understands or really pays attention, okay, because mainly it's peripheral vision that they are losing, okay, their central vision is still good. And most times you might see somebody, the person is looking at you, but if you ask the person to come and sit down, you notice that the person is moving sideways or trying to do like this. But if you ask somebody to look at something far, they can see it very well. Okay. One bad thing about it is you don't know, you can't really tell when it's happening until maybe it's already late. Okay. So best thing to do all these things that I've mentioned, all right? The truth is this, many young people are coming down with glaucoma. Okay. But most prevalence of it are occurring is in age from 40 above most times, all right? But the major thing that normally causes this is because people are not paying attention to their health. I mean, we are talking about the complications of visual loss, okay? Because sometimes if you find it out, we can handle it in the way that you will not lose your vision. You can maintain the way you are seeing, because any damage that have been done cannot be reversed. You can only manage to maintain it. For example, if normally you are seeing from here to to here, all right, and any damage occurs, all right, and maybe you are not seeing from at this point now. That's the if this is the level we have found it. We can be given medication, and there's a form of surgery that is done, majorly to reduce the eye pressure that it comes with, to try to maintain it so that you can see this and it will really not get as bad as that. It causes irreversible blindness. All right, that's why it's dangerous. Many of these eye conditions that I've mentioned causes irreversible blindness. All right, there are many other eye disorders. Okay, definitely. Yes, but these are the major ones that have been listed by World Health Organization. Yes. So another thing is this. Okay, there are ones that let me call it honorable mentions of some eye issues. Okay. We also have hypertensive retinopathy. Okay, which is caused by unmanaged high blood pressure. Can cause some form of retinopathy, that's destroying the fibers around and nerve layers around your retina. There could be bleeding there, different things that you can see, and you might be losing your eyesight. Okay, let's bring it home very quickly. I want to ask you some of those questions, and I'm just looking at the time in front of me. So you talked about a person who bends over to appreciate something in its proper position. Now, because this is for learners and for teachers, what would you counsel that a teacher does to a child in that condition? All right, thank you very much. Okay, the truth is this, in our world today, okay, many people have this issue. Okay, from research, okay, there has been postulated that around by 2050, most people will be myopic. All right, most people will be short-sighted. Okay, I will throw more light on that. Okay, based on your question. All right, if especially teachers or parents, you notice that maybe your child, you might ask the child to pick something. The child will find it difficult to pick. The person might be missing whatever they want position to. Yes, because these are things that we normally see when some people bring their kids around. Or maybe, the truth is this, some children that we are calling dullards might not be dullards. All right? Probably they are not seeing the board very well. And you know, children, and maybe this part of our world, they are less counseling. They might not be seeing the board. So in order not to feel bad or something, they might start playing or they might be fighting. So some of those children that we term that they are dullards or they are not concentrating, this could be an issue. They are not seeing the board very well. They can't even read, because some of these things, especially the refractive errors that we are experiencing, can cause headache. They can cause serious migraine that you might think you might be taking those painkillers. Okay, but it's majorly what your eyes, this strain that your eyes is going through, is what is causing those things. All right. So sometimes for them to maybe write, you understand, they might be feeling headache, they cannot write, they can't focus, they tend to leave it and start playing. And one bad thing about this is this: as children, as kids that they are, they might think it is normal. That's the way other people are seeing it. So it takes teachers to pay attention. So most times I've been advocating that maybe some teachers should go to have some form of preliminary to detect this. Okay, we will definitely talk about this some other time. It's looking like I would have to bring in next, soonest or sooner rather than I was postulating. This is quite interesting. I said I wanted him to have, the entire session, and then we'll take questions. Now, the beauty of this is it avails you the opportunity to start dropping your comments for us. And then the next time we'll be having Dr. Blessed join us on the bookshelf, and then we'll be able to add your questions if we do not have it already. Remember, we do not have every child under our care and tutelage, so we may not be able to tell exactly what is happening per child. There are so many other factors that we are going to be raising with regards, pressure on the eye. Maybe children are playing and then, they get hurt, accidents, and all of that. Would also look into that. And then we'll talk about, there's something Light Eye Care and Opticals does for children.
with regards the treatment and care and all of that. But sincere appreciation to you, Dr. Blessed Omonha, for joining us on the bookshelf.
It's a pleasure. Thank you very much.
All right, value viewer, here is what we guess to call it a wrap. Remember to start dropping your comments, your questions, and we'll bring it on sooner. It's going to be sooner. Really, it's going to be sooner. How soon, you get to find out, or do the justice to drop in. And I wouldn't have to say any more than I have said since my introduction, and of course, joining with Dr. Blessed. My name is Damilola Raphael, your teaching and learning advocate. Looking forward to see you next time on the bookshelf, and wishing you the very best that life has to offer. Remember, we're here rooting for you, looking forward to your success stories. Until next time, we meet it. Goodbye and God bless.